Hello, everyone. Welcome back to Beyond the Smile. So today, I thought we're going to talk about, we're going to pull the curtain back a little bit. And we're talking about some dental lingo. Like when you guys say stuff to us, when you have tools in your mouth, what do you really mean? That's kind of what we're going to talk about today. But before we do, did you watch the game yesterday?
Of course I watched the game.
Wasn't that amazing?
It was
We needed that. As Canadians, we needed to win that game.
absolutely.
Yeah, it was amazing.
I was very, very happy for Bennington.
Yeah.
I thought that was
he
an
got
absolute
crapped on,
redemption.
and he was amazing. So, what I thought we'd kind of seen today is just chat a little bit about a few of the things when you're working with patients and you might say something. How much of it is just yeah, see, I don't have to even say anything, right? So it's funny because, I like my AI and I play. So I asked ChatGPT stuff and it gave me some things were so dumb I added my own. But so we're going to go around and just a few things. The first one I thought was really, for me, and I think we talked about it before, and this might be not lingo, but a little bit it is, when you're measuring gum and there's a bunch of numbers you're throwing out, what the heck are you saying other than like, just rob guys, like get your shit together or what?
So the best analogy I can give you is if you're looking at a collar.
Right.
And so your collarbone is the level of your bone.
Right.
The top of the collar is the level of your gum tissue. What we're measuring is the distance between those two. In practical theory, I guess, 2.72 millimeters is how far your floss and toothbrush bristles can reach down into that crevice and clean it out.
Okay.
So 2s are great. 3s start getting sketchy. 4s, you're already in trouble. There's gum inflammation, which is deepening the trough. If the trough stays deep and the bugs stay there, then the bone disappears and the trough gets deeper and the problems get bigger.
That sounds terrible.
Absolutely. Main thing is you don't want any 4s or 5s.
Okay, so I was going to ask, like, when you're listening, because, you're sitting there, what else do you do? You're listening. You don't, when you hear a 4 or 5, you're like, oh my gosh, that's it? You're done? That's it. Pull all the teeth out. Done.
Well, no, but it's joking. Like pull the floss out, maybe. Maybe pull out the water pick.
That's funny. Okay, interesting.
Essentially, that's what you're measuring.
And do you do that typically like once a year or when you go for your cleanings? It's not all the time. Like, is it just sort of
No, I would say a good clinic that's tracking that because, we want to make sure that what we're doing is helpful.
Right,
we also want to make sure that what you're doing is helpful. Or do we have to tweak it?
Yeah.
But the interesting thing about that number is, like a 2 or a 3 doesn't mean you're safe.
Right.
Okay, so I challenge you to this. You can have healthy bone-gum tissue relationship, but it can still be migrating down and getting long in the tooth, created by a different problem. So you got healthy bone and gum tissue, but it's still disappearing.
Interesting.
So you may still lose
is that
teeth.
where the getting long in the tooth comes from?
Yeah.
Amazing. I've just learned something new this morning.
But it's not a natural aging process.
It's not.
It's not.
Huh.
Like you're not born predestined to get long in the tooth.
Interesting.
Yeah. Stuff happens. So.
See, look at that.
There you go. I bet you ChatGPT didn't tell you that.
I know. I didn't ask for the answer because I'm like, we're going to get the human answer on it. So I'm curious how much of this stuff, when you're, because I always find it, I do find it funny. You're going for cleaning and dental work and you're trying to have a conversation with the patient when they got stuff shoved in their mouth and they can't answer.
Not me. I'm very respectful.
But like, is that done just to like, is that to make sure the patient's comfortable? Like, you know what I mean? Is that because you don't have to talk? I know it sounds silly because most patients have stuff shoved in their mouth, but is it because it just kind of keeps it a little bit more comfortable?
And I think that comes down to, psychology 101, right? Like know your patient, know your relationship. Some people like that. Some people like to just completely tune out.
Right.
And it also depends on what you're doing. So sometimes I'm highly focused and then it's like, hey, listen, whomever it is that's assisting me, you become the storyteller.
That's fair enough. Because I need to focus.
Totally.
Yeah. Interesting.
Yeah. And you want me focused.
Yeah, I would hope. Yeah.
I think. Yeah.
So when you say, that's what I find, like when you say things like, you're just going to feel a little pressure. Is it really a little pressure? Or are you just setting us up to be like, this is going to hurt, but I'm going to tell you that it's a little pressure?
Yeah, well, there's a lot of that, right? So you talk about pressure instead of pain. You talk, discomfort instead of pain. And I promise you, it's not even a class. Like they don't teach you that. You just, I think it's part of your dental ninja skills.
I was going to ask, like, is there? Yeah, I was going to ask that. Do you get taught that, or do you kind of pick it up from just working with people? Because even things like this might be a little sensitive or whatever when you're doing something like sometimes it's way more than a little sensitive.
Yeah. So, and part of it is reverse psychology, right? So you're trying to frame it, right? I mean, quite honestly, it's the challenge of our profession, right? I mean, you're working in a tiny little coffee cup space that's dark and wet and moving, and the patient's alive and awake, and they have issues, and you're trying to keep everything pristine and perfect, and it's a challenge. Difficult. It's a dance. It's a dance.
What about when you hear that we're going to keep an eye on that?
Yeah.
Does that mean that, is that a way of saying like, okay, like maybe not today, but within the next months, and we're going to have to deal with that?
Again, psychology, right? So some people, they need some time to process that, right? So you can't just sort of spring things on them. I generally don't like that phrase because, I mean, I have no idea, and we can ask AI, but I generally believe that every problem gets worse until it gets solved.
Right.
So
that's fair. Yeah, no, and it's funny because I think that's when I was reading through some of this stuff is, I mean, I've been a patient obviously of yours for a while, and someone like, oh, they've never said that to me. Like I've never heard, like the numbers always do, and then I always find it funny having a conversation with stuff, and you're like, like you're trying to answer it.
Well, you can understand more than you think. Yeah. I mean, really, all it comes down to at the end of the day is, my personal belief is it's not for me to decide. It's for me to identify and put that in front of you. And as I often joke and say, you can either build the fence at the top or park the ambulance at the bottom. So you tell me when we're pulling the ripcord.
Yeah, and do you find that are you more of a person that, like you said, you more like to the point, like, one of the ones that came up is you got a little build up there. Like, do you actually say that, or you're like, hey, like, Rob, you need to floss better in the back because we're not, like, you know what I mean? Like, I think that approach is probably more of your approach.
Yeah, and I work hard, I think, to remove those minimizing words, like little and just.
Yeah, fair enough.
Right, and it means it seems subtle.
Yeah.
And maybe it's overtly Canadian. I don't know. But I think there's enough points of confusion per this whole topic of like, what the heck are you really saying?
Yeah.
Right? That, the more straightforward you can be, with empathy, of course. But
it's funny you said Canadian, just got me thinking that how many times do you say, like, do something, both people say sorry to each other, like going through a door, and I'm like, such a Canadian thing.
Well, going back to the hockey game last night, if the U.S. had won, there's no way I believe that Brady Tkachuk is as humble.
Oh yeah.
In his and deferential to Connor McDavid just scored this massive goal, and he's like, I'm so happy for the guys.
He didn't look like he was happy when he got the trophy. I know. It's kind of funny.
It's beautiful, actually.
It is actually. Yeah. It's, well, yeah. I'm curious if you're like, are you when you're in people's mouth, and be honest, are you judging like, come on, Rob, like you need to brush better, or can you tell right away that, like, I'm like, oh yeah, I floss every day, and you're like, BS, you floss every day. Like, you might not come out and say that, but
I might.
Okay.
Yeah, no, I mean, if I literally will say things to patients when I first meet them, just to say, hey, listen, like, this is about you, it's not about me. And the more transparent we are, the better I have opportunity to get you to wherever you want to go. This is not my journey.
No, fair enough, right.
So categorically, I will tell you, I promise, hand to heart, parents' ashes, all the whole stuff, I don't make any judgments, right? I only see challenges.
Right. I totally make judgments. I would totally. I'd be like, you're lying to me right now, and I can't help you if you're going to lie to me. Maybe that's why I'm not a dentist.
Well,
the only reason.
Now I'm worried about my marketing.
Yeah, that's right. I judge. Yeah, all the time. Like, come on, Mark. Why are you posting this stuff on social media?
Exactly.
Just kidding.
There's a little bit, but
yeah. Interesting. I left this in because I thought it was so funny. It says, is it true that dentists can literally smell when someone has a cavity before they're even looking?
I would say no, but I will tell you, you can smell like death.
Well, sure.
Slash necrosis.
Sure. Yeah, I can see that.
But you can't always tell exactly where that's coming from.
Got it.
Yeah. I mean, that can literally be just, you've got a lot of buildup.
Yeah, for sure.
Underneath the gum tissue, everything's, this could be pus, blood.
Yeah, it could be anything, yeah. Interesting.
Yeah. But no, or at least I can't.
Right.
Maybe I need a new sniffer.
Maybe. Need to be better. One of the things that I can't open my mouth. Why? I just can't. So that must be frustrating for dentists.
Are you telling me that you want me to write to your wife that you don't have a big mouth?
Yeah, there you go. So when you say open wide for me, and I'm like, I can't open any wider. like, do you have is there? I remember, and I can't remember when it happened, but when I was getting one of my implants, that I remember kind of be put out a little bit, and someone saying, it's going to be a difficult one because you can't get in there because I can't open my mouth wide. Is there a lot of that you see, and you gotta work around?
Well, you for sure, and that's part of my earlier commentary. Is some people are a dream to work on, and other people they have physical challenges.
Other people are like, Rob, I got it.
Yeah, I mean, it's a gradient.
Yeah, right? It's like Rob to really good.
The interesting thing is, if you talk about things like sedation, like true sedation, IV sedation, that sort of thing, it actually switches off a lot of protective muscle splinting, etc., which can be good, but it can also be not good because you can actually take those patients and overstretch them and hurt jaw joints. So you got to be careful with it, for sure.
Interesting.
But yeah, it's more our challenge than your challenge.
No,
You say that, and I immediately think, okay, Rob, how come you can't open wide?
Yeah, I know. I know you're judging me. See, you said you don't judge. No. You just judge me.
No. I'm hunting the why, Rob. I'm hunting the why.
I'm not coming back. Next time I come back in, it's going to be like, how can you tell, when you ask someone how often you floss or whatever it is, what are the telltale signs that you're not flossing as much as you should, or you're not maybe even brushing? What are some of the signs that you can tell right away? When someone opens their mouth, you can tell that they're not doing what they should be.
It's purely inflammation, right?
Is it? Okay.
So if people are missing certain areas or there's flaws in their technique, you're going to basically see the remnants of what's left behind. If it's an let's say an infrequent flossing, all you have to do is take a piece of floss in between the teeth. Inevitably what you're going to get is bleeding basically right away. And that's the reason why a lot of people stop flossing. They're like, oh my gosh, it's bleeding. It's like, well, yeah, it's because you have all of this infection in there. It's a bit medieval, but it's like bloodletting.
Yeah.
You get past 5 days or so, that bleeding goes away because you've removed all the deposits. You've gotten rid of all of the inflammation that's in there, and now you have a much healthier presentation.
Right.
So it's the consistency, as is the thing in all of life, that is important. Right?
Yeah. Well, it's going to be a little bit of short-term pain, but it'll get better after you do it, right? So, do you have any, and this isn't really a lingo, but I'm curious, do you have any favorite things that you work on as a dentist, or are there things you're like, I do it because I have to do it, but if I've never had to do this again, I would not lose any sleep?
You mean procedures?
Yeah.
I've already eliminated
people, more Robs, no more Robs.
Very few times in my career, which is almost 3 decades now, have I quote unquote fired a patient. That we've had conversations with people before, and it's really just becomes an issue of whether or not we're the right fit,
for sure.
Whether it's approach, values, etc. But procedures, for sure, I have definitely cut some procedures out. And honestly, when you graduate as a dentist, you have essentially the license to do almost anything you want. Right. And yet there are 9 different specialties, right? There's kid specialist, bone and gum specialist, tooth remover specialist, root canal specialist, even crowns specialist. So if you really want to be good and apply your craft, etc., you take constant training. You're continuing to improve your skills. It's very difficult to do that across the whole gamut. So there are always going to be outliers, I think, in each of those realms or regions where it's like, that is the reason why there is a specialty. Right. And so, definitely stuff I don't do. I'm like anti-dentures.
Right.
I don't enjoy it.
But so you did it before?
I did it before.
Okay.
Yeah. Of course.
But you were able to just get it out of your practice because that's not what you want to do.
Right, and quite honestly, now it's been not my focus for so long.
So you wouldn't want to go back.
I'll do implant-supported dentures. But at this point in time, I no longer feel like if you were saying, hey, I want some dentures, I don't know why you would choose that, but if you were, or you're forced into it, I would say, hey, Rob, great choice in your particular presentation, but I'm not your guy.
Okay.
Right. I no longer have the confidence that I'm going to give you the best result.
Right.
And that's what I'm interested in.
Right.
Right.
Interesting.
Yeah.
How about dental phobias? Like, how do you deal with people that, or a lot of things we're talking about, like the lingos, I joked around, like, is part of that just making people feel comfortable that maybe are uncomfortable with dentists, like, or the procedures or what's happening? Because there's a lot, I think I said the story, like when I was a kid, I hated going to the dentist. He was not nice. He had just was rough. There was a whole bunch of things. So you kind of get that fear of going into a dentist. So there's a lot of this stuff just kind of like take a breath with your patients, and like how do you deal with that side?
Yeah, for sure. So first things first, right? Fear is not rational. So
yeah.
I mean, don't try to explain it away.
Yeah.
Secondly, oftentimes in the fear, there's a specific fear, right? So if you can hone in on that and manage that, certainly your demeanor, the environment, all of the different paraphernalia that we can add to the mix, whether it's neuroscience products, and there's a whole gamut. And then eventually, or ultimately, I guess what you have in your back pocket is sedative options, right? You can get into medication if it's required.
Right.
But my experience is, it's probably something like you've had, where you've had bad experiences, and if you're able to subtly hear that person, support that person through that, and start to change those experiences, you'd be amazed at how far people can actually come.
Right.
Right.
Interesting.
I mean, I wish somebody would do that with me for my fear of heights. But
yeah.
I don't know what that program looks like.
Not going up.
Yeah.
What's been one of your big oops moments? Have you had that? Because that's one thing I wouldn't want to hear if a dentist is like, oops, oh crap, or something. Like, have you had a moment where you're like, because stuff happens, either you or someone like.
I mean, sometimes you think that you're able to solve a problem, and maybe you're pushing the bounds of.
You're like, I can do this.
Yeah. Right. You've got, especially early on, you have a lot of confidence.
Right.
Sometimes unjustifiably so.
Yeah.
But yes, sometimes the outcome is not great, and or it leads to something where there's further treatment that's required, and that's a risk. And I think the more that you're in the game, and the more that you see, hey, what I'm doing is man-made,
right? And
even if I do it with absolute precision and skill, I now have to trust you, Rob, that you're going to use your teeth as they're supposed to be, and not as tools, and you're going to do the things that you're supposed to do. And hey, it's biology, right? So. Just like medicine has done a really great job, you go in and you get a hip, and they say, yeah, surgery went really well. And it's like, well, I'm still having trouble walking. It's like, well, the surgery went really well. The picture looks really good. We could do a revision, and you could do it again if you wish. Somehow for us, we have this exacting standard. So Rob comes in, he's coming in broken. Something's not right, which is why we're treating him to begin with, right? It's my job to say, hey, Rob, you understand that you came in with a problem, right? I'm the solution guy. So if it doesn't feel great at the end, I'm still not the guy who screwed it up to begin with. Right? So I think it takes a while to be able to communicate with patients in that manner and not own everything. I think that's where the big mistake in my profession comes from. And I think that's where you say, oh my God, I screwed that up. It's like, well, you didn't really. I mean, you tried, and maybe it was ambitious. Right. And maybe Plan B should have been Plan A all along.
Right. Fair enough.
So
interesting. Is there one thing, or what is the one thing? Is there advice that you give patients that you feel like the one thing they don't follow? Is it flossing? Is it like brushing properly? Is there one thing that you're like, wow, I wish that they would just do this. Is anything come to mind? I mean, those two kind of come to mind are probably the ones that most people slip on, probably flossing and stuff.
And they are, right? And so I always say, it's an ounce of prevention's worth a pound of cure. It's probably 10 pounds of cure in my world. But I often say you'd rather hang out with the hygienist than me. Right. Like, no offense to our relationship. If you're hanging out with me, our solutions are a little bit more advanced and we're a little bit more complex, right? So if you could just slow down and see your way clear to at least once a day, like the end of the day, I say, snap your floss through your teeth.
Right.
Let's focus on technique. You break the chunks loose, then you're gonna take the fire hose, which is your water pick, and blast all of it, and then you're gonna come along with your street sweeper. Right? But you're gonna go slow, right? Most people scrub with that thing. It's like technique is everything, right? And if you did that really well,
like 10 minutes a day of your life.
Not even. It's not even.
It's so funny because I think the last time we did this, you're saying that if you count, most people don't brush for 2 minutes. So I've been cognizant of like the electric toothbrushes are great because they have a timer, but when you don't, sometimes if on the road and stuff, I don't. And I'm like, a couple times I'm just going to do it like I would typically brush. And I'm like, what? It was 49 seconds. I swear I've been brushing for like 3 minutes.
49 seconds, I bet you, is above average.
Yeah, it was kind of funny. So now I'm very like, no, I gotta stay. I gotta do it. Like, but it's kind of funny.
Yeah. Well, and again, just like don't rush it.
Yeah.
Right? I mean,
but we got places to go, man.
Well, you got things to think about too. You can always do that while you
No, you don't want to think. You don't know what's up here.
No, I know. I'm
kidding.
It could be very meditative.
Yeah. Well, it's just funny though how as we've been doing these live streams, I've kind of been, kind of learning more about the dental and practice and how important oral health is to like the rest of your body.
Oh my gosh.
It's something that I've never connected the dots. Like never connected the dots. And maybe a lot of people don't, but how important, how it affects so many parts of your body when you don't have good oral.
Well, I you know me. I love Bubba.
Right. Yeah.
But yeah, I mean, it's the start of a tube running through your body, and 80% of that middle section is your immune system.
Yeah.
So if this doesn't look good, that immune system's not going to look good either, right? So
yeah, it's crazy.
It only makes sense in my mind.
Yeah, but I mean, I suspect most people don't think that way.
No.
Like they don't think that
something's going on. But at least it's a starting point to say, well, maybe I should ask some questions.
Yeah.
Right? And maybe it's not a brushing and flossing issue. Maybe it's an actual nutrition issue.
Right. Yeah,
maybe it's a leaky gut syndrome.
Or whatever it may be,
You name it. Right?
Yeah.
I mean, you read enough health histories as people come through, it's like, it's shocking how many maladies that are out there, in the population in general. And, as we get older, this gets a little bit more gray. It's like, you used to draw a line through no, and now it's like, oh, no, I better explain that one. Right?
Yeah.
It changes. Right?
Yeah, interesting. Awesome. Well, thank you for chatting about partially lingo, partially sort of patient.
Yeah, it's like, I don't think I gave you the secret decoder ring at all. I feel like I can still check around the weird words.
Is there? What's the weird word? What's a word that we might have missed? It's something that what comes to mind?
The ones that you usually get are that every tooth has a number, right? So it's starts with either a 1, 2, 3, 4. Corner 1, 2, 3, 4, and then from the front it's tooth 1, 2, 3, 4. So your wisdom tooth would be corner 1, tooth 8, so 1, 8. 2, 8, 3, 8, 4, 8 kind of thing. So the teeth numbers, people sometimes will get into that, and then for whatever god-awful reason, the front is mesial, the back is distal, the outside is buccal, the tongue side is lingual. I'm sure it's Latin.
Oh, got it. Okay.
I mean, my degree, for crying out loud, is written in Latin. I have no idea what it says.
Are you sure it's a degree?
Listen, it could be a plumber. Who knows? But yeah. Anyways, those are the things. And the subset of my population, my patient population, that really will take that to heart are my engineers. I got like a handful of them that would come in and say like tooth 4 or 5 on the distal, and at first I was like, whoa, what? Hey, and then I was like, wow, that's extremely helpful and very specific.
That's funny.
Yeah,
I didn't even know that.
Yeah,
interesting.
Most people are like, is there?
Yeah.
It's like your like tongue is touching 4 teeth.
This tooth right here. Yeah, exactly. So, maybe we should do that next time. Bring up a picture of it, and we'll go through it.
Oh, it's riveting.
We'll do that with a glass of wine.
Yeah, exactly.
Well, thanks, Mark, for coming in and giving us a little bit of the inside scoop. I think it's kind of interesting to have those discussions from, like I said, the kind of pull back the curtains a little bit of sort of how you think through things is kind of what I'm.
From a patient perspective, all I would encourage people to do is be more themselves.
Be
more transparent. Be more real.
Right.
The more real the interaction, the better the outcomes.
Right.
I promise.
Yeah. Interesting. Yeah. Well, thanks. And if, like I said, if we always say, if you have any questions, just reach out to Dr. Mark or the team at Clone Dental Solutions. Thank you for tuning in to Beyond the Smile, and we'll see you next time. Thanks.
Thanks, guys.